WAPPS-Hemo is a centralized, web-based, accessible program that's accessible primarily to centers that are participating, where those centers can securely input information on patients with factor VIII and factor IX deficiency, Hemophilia A or Hemophilia B, to determine the individualized pharmacokinetics for a patient. So this is something that's incredibly valuable because for the first time we have the ability to have a true calculation of pharmacokinetics with minimal samples based on the Bayesian phenomenon. So it's something that's convenient, it's feasible, and it's accurate to help centers to tailor therapy, to provide education, and to talk to patients about how to meet their goals. Pharmacokinetics is incredibly important. It's important because no one person in one family or multiple families will process a medication the exact same. So you put in factor products. What is the half-life for that particular patient? So is it the expected 8 to 12 hours, or is it longer, or is it shorter? So pharmacokinetics is a very important tool, a very important piece of that puzzle. Not the only piece, but a very important piece. Before WAPPS-Hemo, if I were to think of 10 patients, I would probably do my version of pharmacokinetics on maybe 4 to 5 of those patients, depending on the scenario, depending on the individual characteristics of that patient, what was going on at the time. Since WAPPS-Hemo, if I were to think of 10 patients, I would likely use pharmacokinetics and want that measurement on all of them. As a provider, I think it's really important to us, and to me specifically, because now I can see if what I put in place for the plan, or as the plan for a patient, if it's really working. Am I spinning my wheels, or are we really able to accomplish the goal that I had in mind in the first place? So based on real information, WAPPS helps me as a provider to really understand what we're doing.